Stridor is noisy respiration produced by turbulent airflow through the narrowed air passages. What are its types? Number one is inspiratory stridor due to obstructive lesions in pharynx and supraglottis. Biphasic due to obstructive lesions in glottis, subglottis, cervical trachea. Expiratory stridor due to obstructive lesions in thoracic trachea and the bronchi. And what are the examples? Example of inspiratory stridor, laryngomalacia, and example of expiratory stridor, tracheostenosis. Example of biphasic stridor, laryngeal papilloma. And what are the congenital causes? It includes choanal atresia causing stridor, macroglossia, again obstructive lesion, micrognathia, adenoid hypertrophy. What are the acquired causes? It includes diphtheria, which grow and may obstruct the airway. Hemangioma is a neoplastic lesion of larynx. Foreign body in the larynx causing obstruction and hence stridor. Laryngeal paralysis due to nerve damage. Tracheobronchitis is the inflammation of trachea and bronchus causing obstructive. Tracheal cancer. Prolonged tracheostomy causing stenosis of trachea. Tracheoesophageal fistula causing stridor. Retropharyngeal abscess is a lesion outside the respiratory tract. What are the physical examination for stridor? Prominent one is recession in suprasternal notch. What are the associated characters? Snoring, gurgling sound in the patient, and hoarse cry in the babies. Stridor disappears when baby lies in prone position, such as stridor of laryngomalacia. We examine the nose of patient to exclude other pathologies. We examine the tongue to make our diagnosis. We examine the jaw to exclude other pathologies. We examine the pharynx of the patient. We examine the larynx of patient. What are the investigations for stridor? To see foreign body soft tissue lateral and posterior inferior view of neck. To see foreign body lateral and posterior inferior view of chest. CT scan such a condition called double aortic arch. Esophagogram for tracheoesophageal fistula. Direct laryngoscopy. Treatment according to the cause. So guys, if you find this video worthwhile, please subscribe our channel Medical Stuff.